Thank you, Chairman. Mr. O'Brien, I just want to ask you, do you believe, as your position in HSE, that the HSE or part of the HSE, due to the fallout of what's after happening and probably the disaster that we have on our hands at the moment, is the HSE or part of the HSE dysfunctional?
In respect of this process, clearly cervical check was dysfunctional, yes.
And when we talk about dysfunctional, did the alarm bells not go off with you when you're admitting now that there was a dysfunction within the system? And how come it took so long when it took Vicky Phelan to bring a case to court and win her case, and she was trying to be silenced as well through that case? I know it's not to do with the HSE, I know it's due to a foreign company, but there's someone within the whole system of all the people that work in the HSE not see a dysfunctional here and step in and try to stop it? Or is anyone responsible for what's going on, including yourself?
Well, what I can tell you is that I was not made aware in the way that I should have been of this case. This case went into legal process, I believe, in January, was concluded in April. There would have been opportunities before and during that case for someone to recognise the seriousness of what was happening and to escalate it to me. They didn't. In a different forum, many of the people who might have escalated it to me confirmed that they hadn't. They had nothing to gain by confirming that. In fact, they had potentially things to lose by confirming that. But they confirmed that they had not escalated it to me. And because it wasn't escalated to me, there was no potential for any alarm bell to ring in my head. Had I been aware of it, alarm bells would have rung. And I said to a different committee yesterday, where Deputy Kelly was present, that had I known that there were a significant number of women who had gone through the same audit process and who hadn't been made aware of their results, the first thing I would have done would have been to make sure that they were aware of those results, so that by the time this did come into the public domain in the way that it did, there would have been no cause or reason for other women to be concerned that they might be about to be told. And that's one of the most regrettable aspects of this whole case.
Are you saying then, Mr. O'Brien, that there are people under your control that are culpable and are responsible and did not take action and were dismissive in their job? And have you identified these people, and would there be consequences for these people? I mean, this is important stuff that the women of Ireland out there who are in crisis at the moment understand how the HSE works and the functions with it.
Once we declare a serious incident management, the things that you've identified are not the immediate focus. The immediate focus here has been as follows. First of all, to make sure we understood the totality of the nature of the audit, and as you're aware, we learned during the process issues to do with that, to make sure there were effective processes in place to communicate with all of those who are the subject of the audit. And we have got, I think, to 201 of 209. There's a challenge establishing communication with others who may be out of the jurisdiction or on leave, but we will pursue that continuously. To deal with all of the persons who, as a result of concern or worries, are making contact with the helpline, and we're arranging for each of them to have a detailed, over-the-telephone medical consultation. That is taking quite some time. We're also carrying through a number of data check processes to ensure that we have a full picture on this, and that has to be the priority at this time. Other things will follow in due course. And of course, we also now have the appointment by the government of Dr. Scally, who will carry out the scoping exercise, which we will cooperate with fully.
Again, just to clarify, will people, if they are found to be neglectful, will they be held accountable and will be consequences for these people within your system?
Anyone who is found to have failed in their duty will, on the basis of an appropriate consideration of that evidence, following due process in accordance with the disciplinary procedure, be called to account, yes.
Now, will we know the public be aware of this?
When the process is concluded, of course, yes.
Okay. Do you think that the services and across the board, the services of the HSE are professional and that they're rolled out in a proper manner, and are they fit for purpose in general?
Overall, I think we have a health service that performs at a very high level against enormous challenges of demand. which have already been well documented in the government review of capacity and so on. We all know about the difficulty in getting access. But patient experience surveys carried out jointly by ourselves, HICWA and the department, and published by HICWA, show the way people feel about the services that they receive from the HSE. The biggest challenge, of course, is one of access. But this situation aside, I believe that we are served very well by highly dedicated, professional and committed health service staff throughout the country, and that also goes for staff in cervical check and screening programs who are as devastated as anybody by the circumstances that have now unfolded.
Are you confident then that at the moment there's no other section within the HSE besides the cervical screening programme that there's not a problem that we'll get next year or 6 months' time or 3 months' time? That is this bringing the HSE alert to other parts of is the whole system being looked at and the rollout of the service that we had, and is it fit for purpose? That's what I'm trying to ask. Yeah. Are you happy that this is a one-off and there's no other something else happening at the moment that we are not aware of, and maybe you're not aware of, but that have you a system in place now to check all the services that are
through the review that the Minister has announced? There will be a cross look at other screening programmes to ensure that they're operating in accordance with best international standards. We are carrying out a specific case management review in this instance to ensure that the warning bells that didn't sound in relation to this case will sound in the future, and we'll be working closely with our colleagues in the State Claims Agency in relation to that. And all of those who are in charge of hospital groups and community health organisations are very much aware of the need to ensure that every step is being taken to assure the quality of services, recognising that the biggest challenge to the quality of our services actually is getting access to them, not the quality of care once a person is in them.
I don't know. Can I just throw two more questions? Will I get a second chance?
Yeah, we're going around again.
I only got to ask one question.
I know you weren't here at the beginning, Deputy. I explained to everyone there's a different system working today because we have the shortest period of time.
I will get it again.
Well, we're going to try and get around again. Deputy Burke.
Deputy Aylward, and this will be the final.
Thank you, Chairman. I have only two quick questions. Just following on from your own question to Mr. O'Reilly, Mr. O'Brien. Mr. O'Brien, I do not accept your opinion that this appointment to a board, while you're still a senior public servant, Director General of the HSE, which has
I wasn't asked about that with respect.
Well, I'm asking now anyway. Okay. Your appointment to it, I can't believe that a Minister, Harris, here, Minister for Health, sanctioned, or government sanctioned. You have an onerous job as head of the HSE. If you're retired, which you will be shortly, if you're retired, by all means, I don't see no conflict here. But to think that when you had a job of such consequences here in this country, and that you're allowed to join a directorship on a board in America, which you said wasn't going to interfere your job. You still have to go over there. I think it was once a month. I read somewhere along the line you're going on this.
I'll be happy to tell you about that.
Yeah, let me finish first then. And that is acceptable to you and to the system here in Ireland. I don't think that's good. A senior public servant like yourself with responsibility to be allowed while you're in charge of where you are, the responsibility you have, to be allowed to sit on another board in a foreign country, I think is not good practice, and I said it shouldn't have been allowed. As I said, if you're retired, by all means, no problem, but while you're still active, I can't believe how the government sanctioned it.
Just to be clear, in fact, I've not been to the United States at all in connection with this process, despite some very strange media reports. The actual time commitment is in the range of 1 to 2 hours per month in this phase, although currently I'm taking a leave of absence from that, as you're probably aware.
Yeah, aware of that.
I asked...
That's because of the circumstances you're taking leave of absence. You weren't intended to take leave of absence until what blew up the storm is you're dealing with now.
No, that's correct. I wasn't intending... In fact, my intention was to be on leave this week and to be in that country. As it happens, I've never been to that location. This will wait for another day. I followed a procedure set out in my contract of employment. I applied appropriately. I was given consent appropriately. The organisation in question has no products on the market. There is absolutely no conflict of interest, and the amount of time absorbed in a non-executive director role at this stage in the life of that process is minimal. And I actually spend, for your information, far more time leaving my house in the late hour of the night to respond to 999 calls than I ever did in relation to that company at this stage. So there has absolutely been no impediment to my functioning as Director General. And some of this wild reporting that says I spend 5 hours a week is complete nonsense. Like so much in the media today, it's just made up.
Deputy Aylward,
I have another one. Do you think it's normal, just sort of finish that, do you think it would be normal then for this to happen in the future, for other Secretary Generals in this country to go on a board anyway? You think it to be normal and to be good practice?
I have no idea whether it will be normal or not. Each judgment is made on a case-by-case basis. The standard contract of employment for chief execs of state entities such as this provides for a process where you can apply for the consent of the Minister if there is a remuneration involved. I have 2 consents from 2 different ministers, one of which relates to a pro bono teaching commitment that I have in relation to a health sector related higher level course in a 3rd level institution in this country, in respect of which I give about 15 hours a year and in respect of which there is no remuneration. The second is in relation to this issue that you're aware of. What I can say is that I followed absolutely the correct procedure in relation to this.
Okay. Second question, last question. Just the rollout of the cervical screening programme in 2008, I believe, when it was originally rolled out. Were you part of that originality of setting up the screening programme?
Yes, I was. In 2007, I became, having previously been Director of BreastCheck, I became the first Chief Executive of the National Cancer Screening Service Board. That board was created to continue with BreastCheck, to seek to roll out what had been a fledgling, regionally based Irish cervical cancer screening programme from about 1996, which hadn't rolled out at that point, and also to begin the investigative process around the development of bowel screen. At the time, I was very pleased to be given that opportunity because as early as 1993, when I was Chief Executive of the Irish Family Planning Association, I had participated in a lobbying exercise to seek to win government policy, and I hope I played some small part in the development of the pilot programme in Limerick. That programme in Limerick, 12 years on, had not achieved all that it could. We were processing in this, we were having as many smear tests taken, I should say, in this country without a cervical programme, probably more actually than we do now with an organised programme. And do you know how much difference it had made to the incidence of cervical cancer? Absolutely nothing. Women were waiting up to a year in some instances for results. You couldn't roll out a screening programme on the basis of that. Some of those tests were being done on kitchen tables at home on overtime in non-quality assured circumstances. So the priority was to ensure that this country got a cervical screening programme in order to minimise the incidence of cervical cancer and to reduce deaths from cervical cancer. This programme has brought down the incidence by 7% a year. There have been 50,000 high-grade detections of CIN, which is an abnormality of the cervix, a precancerous abnormality. And I am absolutely certain that one of the best days' work I ever did was to ensure that this programme had a national cervical screening programme that's currently called Cervical Check. And I know that it has saved many, many lives, and I'm very pleased that it has, and I thank you for the opportunity to say that today.
Okay, Mr. Bryan.
All very honourable and accepted, and fair play to you. I accept that. Can I ask just outsourcing and the contracting to America? Then this last one is the same subject. The outsourcing. Why was America, this laboratory in America, picked for the outsourcing and the contract there? I'm told, I don't know if it's true, there was other laboratories here in Ireland were capable of doing this. And
we need to be very quick in fairness to your good self.
Why didn't we go to Great Britain, or why didn't we go to Germany and France? Why did we go to America so far away? And these misdiagnoses have results of some of these results that we have are mostly from this American laboratory.
I'd slow down with that if I was you.
Well, okay. It's not an accusation. This is what I'm reading in papers.
What I would do is I would wait for the scoping review to give you some hard information on that. Just to be fair, there was an open competitive tendering process carried out in 2008 which followed quite a significant public debate, including a debate in the Houses. There was a debate on this in the Dáil at that time. Some of you may have been there, I'm not sure. It was carried out in accordance with European standard procurement. The requirements were that the laboratories had to be accredited to the relevant ISO standard. I can't remember the exact number of it now, ISO 15 something or other, and that they had to have a volume of 25,000 tests per annum.